In Grand Cayman on the 24th of April, I went supermarket shopping with my mum and got out of the car and said, "Mum, I feel really strange, there's something very odd." She said, "Okay, I'll phone Paul, my husband." But before Paul got there, I actually had collapsed and had a seizure, which I'd never had before.
She was rushed up to Health City, which is one of the local hospitals here, and I also received calls from the hospital physicians over there as well, and they said, we really need to get her over as soon as possible.
And having a kind of international coordinator based on the island is just so supportive. Whether it's sorting out the flights, within a week I was flown down here. I saw Dr. Linfanti.
The patient is a delightful woman who all of a sudden had a generalized tonic-clonic seizure. She had an MRI, she had an angiogram that shows a vascular malformations of her brain.
Arteriovenous malformation is a type of vascular lesion in the brain. It is something that a patient is born with, and it stays dormant for a number of years, and most of them present maybe at the age of 30, 40 years old, when patients may develop seizures, complain of headaches, and in some cases they may present with hemorrhage.
The approach that we typically use, we do an endovascular embolization. So we thread a small little catheter inside this vascular malformation and inject a substance to make this malformation, these vessels, very hard. So you stop right there the chance of bleeding. Subsequently, the same day or the day after, the surgeon, in this case Dr. Slijper, goes in and is able to remove safely this vascular malformation.
I was in ICU for 2 days after the surgery, and then I moved up the next stairs. I was up and walking. Next day, I was determined.
I think Miami Cancer Institute is definitely an asset to the Americas. It's been great to be able to expand beyond the South Florida area to the international community, and I have to say, in 4.5 years, I treated patients from both Central, South America and the Caribbean, and seen the impact of our work.
This is a phenomenal facility. Just the care, the coordination, the way that it is smoothed out for you, where you do not have to worry about anything. You feel as if you're in a blanket, I think is the best way to describe it. A comfy blanket. To all of them from the bottom of my heart. Sorry. Thank you so much.